the Asantehene II has added his voice to calls for the retooling of Confirmatory Teaching Hospital. This comes after some doctors in the oncology department of the hospital went on strike demanding the activation of an essential equipment in the treatment of cancer patients. Now, though the doctors have called off their strike, the Asantehene says the lives of all are threatened by the absence of essential equipment for healthcare delivery. Nana Ojima visited the hospital with the health minister and filed this report.
The Asantehene is appalled by the absence of essential equipment for healthcare delivery. His checks at the cardio unit of the Confirmatory Teaching Hospital has revealed the need for some life-saving equipment at the facility.
We struggle with basic equipment. Dialysis machines are hard to come by here. They tell me Kath lacks some life-saving equipment. If I have an emergency and I am taken there, they may not be able to treat me. Where do they take me then? By the time I am taken to Accra, something bad would have happened.
The need for retooling of the hospital was also emphasized by management of the hospital when the health minister visited. Explaining the strike embarked by some doctors, the chief executive of the hospital, Professor Asantehene, says the facility has incurred a huge cost of fixing the LINAC machine at the oncology department. But for the effective use of the machine, there was need to acquire a water phantom at $109,000 for the calibration after inability to fix the machine. Professor Asantehene explains the necessary measures had been taken to procure the equipment before the strike.
The water phantom had also broken down, and there was a need to either fix it or get a new one. Our engineers tried very hard and then realized that we needed to buy one at the end of the day because they could not fix it. They cost $109,000, which was not budgeted for. But we were convinced that, given the fact that Confirmatory is the second cancer center in Ghana, public, there was a need for us to fix it so that the number of patients who were coming here with various cancers could be attended to. So we started the processes. The LCs were done and sent out. Unfortunately, we had a letter sent to us by about 9 doctors from oncology to say that it has taken too long for the machine to be fixed, and that by a certain date, if the machine was not fixed, they were not going to see patients.
Health Minister Dr. Bernard Okoboy has assured of working with the hospital to realize the set objectives.
I mean, anyone who finds himself or herself in the middle belt, should you get a medical emergency, you are likely to land here, depending on the degree of the emergency. So, working together with Kath to address your challenges is in our interest. All of us are interested. Because the next time I might be the one in these 2,500 visits, my count might be in. I want to give you the assurance that we'll work speedily to help the retooling. Hospitals like this, because of the numbers, sometimes even when you get equipment or tools, within a short time, you need replacement and all that. So we appreciate the concerns, and we are going to work closely with you.
Meanwhile, the Ministry of Health has donated 100,000 cedis towards the Heal Confirmatory project, which is aimed at renovating parts of the hospital. For Joy News, Nana Ojima, Kumasi.